Hi guys, it's me, Professor D, and if you're new here, welcome to my channel. If you haven't done so already, please press that like and subscribe button below. On this video today, I'd like to talk to you or actually teach you how to prioritize patients. Lots of students have trouble with this. You have situations or scenarios given to you, and you have to decide which patient you're going to see first. So I'm going to make this as simple as possible. The first thing I want to discuss with you is Maslow's hierarchy of needs. You guys learned this first semester of nursing school, okay? Maslow's hierarchy of needs. What's most important is what's on the bottom of that pyramid, and that's what is called physiologic integrity. And physiologic integrity, guys, basically that's what's keeping that patient alive. So everything on that list, if you take a look at that pyramid, you'll see food, breathing, nutrition, sex, sleep, but there's more to it than that, okay? So I've added onto this list, and everything I've added onto the list, that belongs in physiologic integrity. That is what's sustaining that patient's life, keeping them alive. And so that's going to be a priority to you. So let's go through that list, Fluid and electrolytes, okay? Such as sodium, 135 to 145, potassium, 3.5 to 5. You okay? And matter of fact, you see potassium? This is how we kill inmates in the state of Florida, okay? If a patient's on death row and we give them lethal injection, we give them potassium, it stops their heart. So fluid and electrolytes are very important, and it will keep a patient alive or kill them, all right? ABC's airway, breathing, circulation. If an airway has not been established, that patient's not going to be able to breathe, okay? So airway comes first. You got to make sure a patient's breathing. We don't care about anything else if a patient's not breathing, okay? Airway, breathing, circulation. Is that heart pumping? Is blood flowing through the body? Hemodynamics, blood flow. Is the patient clotting too much? Are they bleeding out? Okay, that can kill a patient. What else do we have? Nutrition. Is a patient malnourished? Are they missing vital nutrients and vitamins that will keep them alive? Immediate suicide risk. What do I mean by that? When you're assessing a patient for suicide, and of course, suicide, that's something serious. Obviously, you know, a patient will die if they kill themselves, right? Okay. So anyway, suicide risk. Well, the reason I put immediate before then, when you're assessing a patient for suicide risk, what's the first question you ask them? Do you have any thoughts of harming yourself or others? And if that patient says yes, your very next question is, do you have a plan? What is your plan? Do you have access to whatever you plan on using? So for example, if the patient says that they plan on killing themselves with a gun, you say, do you have access to a gun, right? The reason I wrote immediate suicide risk, what if you live in the state of Florida and the patient says that they plan on killing themselves by jumping off of a mountain? Well, obviously, that's not an immediate suicide risk. So you might go see another patient that's bleeding out or another patient before this one because they're not in immediate danger. So that's why I put that word immediate. And I did that on purpose because I've seen plenty of test questions where, you know, they ask you which patient are you going to see first, and you run to the patient that says suicide, but you didn't read the whole choice. Patient said that they were going to kill themselves by jumping off a cliff, but they're in a facility right now, okay? Glucose levels, that can kill a patient, okay? Remember what I taught you in my last video? If you haven't had a chance to watch the glucose video, please be sure to do that, the one on diabetes. But glucose levels, that can keep a patient alive or kill them. Which one's more dangerous? Hypoglycemia or hyperglycemia? Hypo. That patient's blood glucose dropping low is much more dangerous than the patient's blood sugar being high, okay? And I explained that in my diabetes video. Make sure you guys watch that. And of course, vital signs, the patient's blood pressure, their heart rate. So everything on that list falls under physiologic integrity. What is physically keeping that patient alive? So whenever you get a test question that's asking you about prioritizing a patient, who are you going to see first? If anything on that list is abnormal, that's what needs to be your consideration on who you're going to be seeing first. Now, let's talk about pain. Because when I discussed physiologic integrity, you didn't hear me say pain, okay? And here's the reason why. In nursing, we have a saying, pain never killed anyone. Except there are certain situations that pain very well likely can kill the patient because it increases the patient's metabolic demands that the patient just doesn't have. So I'm going to give you those situations where pain is just as important as the heart rate, as the pulse, as the glucose, as nutrition, okay? These 4 situations are burns. If it's a burn patient, it's priority that that patient gets pain management along with other things. Make sure you guys watch my video on burns, okay? So burns. Next, stones. If the patient has kidney stone, bladder stone, I don't care what kind of stone. It could be calcium, it could be struvite, it could be oxalate. If it's a stone, that pain is so bad, it's so harsh, medication is a priority, okay? Third, sickle cell crisis. That's another one, okay? That pain is so intense, it will increase that patient's metabolic demands. And at that time, if a patient's going through sickle cell crisis, hemodynamically, they're just not stable enough, okay? So you have to give them analgesics. And the last one, obviously, is myocardial infarction. If the patient's having a heart attack, okay, one of the main things you want to do is rest the heart. You want to rest the demand of the heart. And if that patient's in pain, their demand's going to go up. So you have to give that patient an opioid, and that is a priority, okay? So when it comes to those 4 situations, your burns, your stones, sickle cell, and myocardial infarction, pain falls on the bottom with everything else that is in physiologic integrity. Anything outside of those 4 situations, pain never killed anyone, and pain goes up top where self-actualization is, okay? So let's talk about self-actualization. That's at the very top of the pyramid. What else goes on top up there? Teaching, patients, self-esteem, anxiety, fears, their feelings, and of course pain. Pain other than your sickle cell, your MI, your stones, and your burns, okay? So if you have a priority question and they're asking who do you see first, and you have a patient that falls under the scope of physiologic integrity, and then you have another patient that falls under the scope of self-actualization, you're always going to choose the patient that falls under physiologic integrity, because who cares about what's going on with that patient if they're not stable to live? Just to point out to you, and I hope that really helps to clarify for you which patients are priority. On the next thing I wanted to discuss with you very quickly, I wanted to go over the examples of the types of patients that you as a nurse are going to run to immediately, okay? If you get a different situations or scenarios, there are certain hints that let you know this is the patient that you better be running to. And those examples are any patient that has apnea, dyspnea, shortness of breath, any problem with breathing, you are running to that patient before anyone else, because who cares about what's going on with that patient if they can't breathe, okay? That is priority, okay? Next, chest pain. Any patient that's having a sign and symptom of a myocardial infarction, of a heart attack, patients having chest pain, you're going to be running to them to go check them out. The patient that's having signs and symptoms of a stroke, right? Those patients that are having unilateral muscle drooping or weakness, or all of a sudden they're having a confusion, or they're having drooling, those signs and symptoms of a stroke, you're going to be running to that patient, because remember, when it comes to stroke, we're actually on a time crunch. We got 3 hours to give that TPA to have the most positive outcome for that patient. Any change in level of consciousness. And when I say change in level of consciousness, obviously for the worse. So if a patient was confused, now all of a sudden they're becoming alert and oriented, we're not going to be running to them, because that's a good thing. But if you had a patient that was awake, alert, oriented, and all of a sudden they're confused, you are running to that patient, because that confusion lets you know something is very, very wrong. And very often what's happening, for whatever reason, the patient's not getting oxygen to their brain, and that's why they're having that sudden confusion, or it could be a stroke. So you're going to be running to any patient that has a change in the level of consciousness, such as confusion or a lethargy. Signs and symptoms of shock. You see that blood pressure start to go down. You see the hemoglobin and hematocrit go down. You see that heart rate go up. Those are signs and symptoms of what? Shock, right? If you see signs and symptoms of shock, you're going to be running to that patient. Change in their status or condition. Any patient that was doing well, or at least they were stable, at the minimum, they were stable, and all of a sudden their condition changed and they're doing worse, you're running to that patient. That's a priority patient. And some key terms, if you see terms such as suddenly, all of a sudden, severe, that lets you know that there's been a drastic change and you need to be running to that patient. That is also a priority patient. Guys, I hope this video has helped you. I hope that's clarified for you what types of patients are priority for you to be running to. And I really would like to get more videos out there for you. So please, any topics that you'd like clarification on, please put it down in the comments so I can make sure that I make a video for you. And please do not forget to like and subscribe below to keep the videos coming. Thank you so much and see you next time.